Hello, everyone. Thanks for joining us on the media briefing for this Wednesday, this rainy Wednesday. And we're going to start with the weather. We have an addition to our rundown. We're pleased to be joined by Randy Ishii, the Director of Community Services for Monterey County, including Public Works, who's going to tell us a little bit about what's going on with Public Works and rain issues today. Hi, Randy. Thanks for joining us.
Good morning. Thank you very much, Maya. And good afternoon, everyone. Thank you for inviting me to be a part of this. Wanted to start off by providing a brief update for everyone about the winter weather that we're still experiencing, as well as actions being taken currently to address the issues near term as well as long term that the public is seeing. As you all know, we had the atmospheric river that came through in late January 2021. It caused damages not just in one part of the county, but throughout the entire county, of which we are still recovering from. And in many locations along River Road, for example, there's either been debris removal or emergency repairs performed by both county staff and our contractors. However, last night's storm brought in a level of intensity that did bring debris back down onto various roadways, some of which were already affected by the January 2021 winter storms. Very specifically, early this morning, by virtue of our standard processes, the California Highway Patrol alerted us that there were debris issues along River Road between approximately Las Palmas and Chular River Road. The maintenance staff from Public Works quickly mobilized out, as well as our engineering staff for further support and for damage assessments. And what we discovered was that there were debris flows in certain locations along Pine Canyon Road, along River Road, but mostly near the Chular River Road area of River Road. And then here again on River Road along Fairview, which is south of that location, but here again, a spot that was affected by the January 21 winter storms. At this point in time, much of the mud on the road on Pine Canyon and Lime Kiln roads has been cleared. Culverts are flowing, and if they were not, they were cleared by county crews or our contractors, and flow was reestablished, and thus the culvert pipes are flowing again. We've received a few phone calls from constituents of Pine Canyon, which we appreciate you letting us know about the issues. We've gone out and addressed those. But some things that we want to point to at this point are where I flagged earlier that there were damages from before that we're still addressing and that the storm has exacerbated. On Chular River Road and River Road, there were debris flows there previously, and staff had worked very hard with our contractors to remove that debris. Well, more debris came down, and it was at a level beyond our maintenance capability. So we had our contractors go out there, and as of 11:30 today, that location has been cleared and reopened. So if you were to go out there at this moment, you'll see some light sheens of soil on the road, but the road is open and drivable for both lanes of travel. Fairview Road and River Road, however, is one where it has been impacted, but we have it at a stable point as we speak. There was a lot more debris that came down from those uphill areas, and the soil came across the road. And despite having some temporary culverts in place to let water around and to naturally go back into the natural drainage course, the silt and mud that did come down was enough that it impacted the ability of that pipe to send flow back to the natural drainage course. That being said, we mobilized our contractor out, and what they discovered was sheets of mud approximately 1 foot thick to 3 foot thick in some locations along that stretch of roadway. At this time, our contractor has cleared a 1-lane emergency access path through that mud and silt so that emergency responders can get in and out of the area and that local traffic can happen again. We needed to temporarily close that road while we did this work, but we now have it at a point where it can be reopened. We'll be receiving further updates from the crews as they proceed further along through the day, and we will continue to keep our public posted through our road closure information page, as well as through our other sources. May I hand it back to you?
Boy, thank you very much for jumping in really at the last minute, because we've had a lot of inquiries about what is going on. And I also wanted to let people know that they may have received an advisory about mud flows and debris flows in the river fire burn scar area. It is not an evacuation advisory. It is just an advisory for the issues, much like Randy has been talking about. So thank you, Randy. And if I'm going to let Randy go and get back to the business of repairs, are there any questions for Randy before he leaves? I don't have anything in chat, and I know he was unexpected. Are there any questions for him before he leaves the briefing? Not seeing any. And here, let's see if there's one. Oh, Randy, could you share the best website for the road closures? I know that if they go to the homepage, there is a link to that, but is there another link you'd like to share?
Certainly, we have two avenues available through Monterey County's homepage. We have both the Public Works road closure and information page, which I will put into the chat for everyone here. And secondarily, our Monterey County Office of Emergency Services is mirroring off of our layer file and data for road closures. So you can even go to the OES website and the information will also be reflected over there. And we keep that as up to date as we can as we get updates. And before I go, I do want to remind everyone that if they do see an issue, if you see something, please say something and communicate it back up to us. You may contact us by phone at either 755-4925, as well as 755-4800. You may also use electronic means, such as sending us an email at 300-service requests, which I'll also leave in the chat. Or you may use Monterey County Connect, a very useful app available free from the app stores for any smartphones.
Thank you again, Randy, very much for jumping in and filling us in on what's going on this afternoon. We'll let you go. And now we'll move on to our scheduled items for today. We're very pleased to be joined by Krista Hani, who is a Planning and Evaluation Policy Manager for the Health Department, and Roxanne Seepersad, who's a Public Health Epidemiologist with the Health Department. And they're going to tell us a little bit about the data from the call center. And as people may recall, after the shelter-in-place order was given, the call center stood up shortly after that to answer people's questions. So now we've got a year's worth of data to take a look at. Hi, Krista and Roxanne.
Thank you, Marianne. So yes, I'm going to basically just introduce Roxanne. She's an epidemiologist with us in the PEP unit and helped set up the Power BI that we use to present the data. Anyone can look at it out in the public weekly, but we wanted to give a summary of sort of the patterns and trends that we had over the year and the work that was done by the plethora of staff that got called in to help out on this project. And much thanks to all of them from the health department across all our bureaus and other departments where we had disaster service workers redeployed to work with us. So I'll let Roxanne give you a short presentation on what our data show for the year of the call center.
So hi, good morning, everyone. I am Roxanne. So Monterey County Health Department, as previously mentioned, it was developed to assist with helping the community with COVID-related information or having a way in which they can voice their concerns that would then be addressed. And this call center data, we actually started tracking it at the week of March 22nd, 2020. The call center staff, in addition to answering and relaying this information immediately related to COVID-19, also expanded and did some additional outreach efforts for the past year, including providing test results for community members that were tested at the pop-up sites, and also assisted with signing or getting individuals signed up for vaccines as needed, and also following up with the community to see if their needs were met. So since its sunrise, the call center has operated with a core group of staff members in a total of, for the course of the pandemic response to meet the call volume, we've had 37 part-time, full-time, and administrative staff members. Many of the staff served part-time as they usually work in other program areas within the health department or the county. The staff all received training and on conducting follow-up with calls. Due to the huge influx of volume in early February, we instituted 2 weeks of voicemails and automatic information reply or a robocall. And this was an automatic voice messaging system that was sent out with generalized information and the option to return the call to the call center if the questions were not answered with the information that was provided by the reply call. Okay, so over the course of a year, from March 22nd, 2020 to March 8th, 2021, 17,568 calls went into and out of the call center. The number of calls does include the calls that staff made to provide their test results, and you can see that on the screen with an increase in call volume in October. So that's really why you see that jump there. And then in January, with the end of the stay-at-home order and transition back into regional stay-at-home order, as well as the availability of vaccines into Monterey County, the calls began to increase substantially. And because of this influx, again, the robocall system was developed. And you can also, even with that, automatic messaging assisting the call center staff really had an increase of calls, and the highest number of calls that they received in one day, excluding the robocalls, was 508 calls, which is substantially higher than the amount of calls that was going in and out of the call center in the previous months. So of the 17,568 calls in the past year, the majority of the calls were vaccine-related inquiries, followed by information pertaining to the shelter-in-place order. But this shelter-in-place order highlighted on the screen also includes questions about state orders, regional stay-at-home orders, short-term lodging, and then coupled with the face covering orders, which is at just 174 calls, it still is at number 2 on the list. And then the third is testing inquiries. Up until January 2021, the top reason for calling into the call center was due to the SIP orders or questions related to sheltering in place, followed by testing and then reporting sicknesses at an individual level or due to business exposure to COVID-19. However, since January 2021, again, that huge influx has shifted what we see to about 75% of our calls being related to vaccine since January. When the calls are received into the call center, the staff collect information in addition to the reason for calling. So they collect some demographic information, the location of the caller, but also the city of their concern. So the city of concern field is used to identify an area in which a need may present itself at a disproportionate rate, to follow up on areas such as enforcement complaints, and also to identify where there are possible illnesses or business exposures that are appearing throughout the community. So Salinas has consistently been at the top of the city of concern. However, we identify that the city of concern is not always available at the time of the call, or it's just not provided throughout the call. So its unknown city is reported at 17%. And also County of Monterey is documented as the top city of concern. But it does include inquiries made about generalized orders, inquiries pertaining to more than one city of concern. So if someone was calling from out of state, for example, and wanting to know what the local orders are here in Monterey as they travel in and out of the county, and didn't identify a specific city that they were concerned with, that may be included in this count. That is included in this count, actually, not me. So the data really does highlight the fact that the call center is being used by community members throughout the entire county, and it is widely used by the public. We get several calls from members outside of Monterey County, including, again, those traveling and wanting clarification on orders, and also public members reporting COVID-related concerns in neighboring counties. 92% of call inquiries received by the staff were addressed at that time of the call or had a follow-up that was completed within 1 day of receiving that initial call into the call center. 95% of the calls that were made to the staff, made by the staff to report the test results at the pop-up sites were successful on the first attempt. While many of our staff are bilingual and the language options are also available, the majority of our calls are conducted in English. While the number of, that percentage that you see there, number of calls in Spanish is 10.83% over the past year. The data does show that Spanish speaking calls have been slowly increasing at a little less than 1% per month. And due to the increase in call volume, over 6,000 calls since January, as mentioned previously, the robo system or the automatic system was developed over a 2-week period to meet the challenges of the call demand. To ensure that issues were being addressed, referrals are made to environmental health to follow up with enforcement complaints, and also with city officials. There's a bit of a collaboration effort there to also follow up on some of these enforcement complaints that are reported by community members. With calls regarding, possible COVID-19, a confirmed case, or business exposures or outbreaks, these types of calls are referred to the communicable disease unit within the health department for further case investigation and follow-up. And to ensure that the concerns are being addressed with needing vaccine registrations or any social services needs, the call center has partnered with the United Way and Department of Social Services to aid in addressing the community's concerns and needs throughout this time. So with all of that said, the call center contributed to a collaborative effort in reducing the spread of COVID through providing information to community members about needed information for statewide orders down to addressing individual needs and linking them to the proper resources over the past year. And that is it. I'll send it back to Krista for final comments. Thank you.
Thank you, Roxanne. Krista, is there anything you'd like to add to Roxanne's presentation?
No, that was a great presentation. Thank you, Roxanne.
Terrific. And if you would both stay on the call in case we have some questions for you after our next presenters. We're going to move on to Diana Jimenez with the Department of Social Services, one of the deputy directors, and she's going to bring us up to date on the Great Plates Delivered program and some other meal options for seniors. Good afternoon, Diana.
Hi, Maya. Thank you for this opportunity. And I'd like to share that we got notice from the state that FEMA extended the Great Plates Delivered program another 30 days and through April 7th, which will enable us to help or continue to help seniors at risk of COVID to shelter in place, stay healthy through the delivery of meals, and also to provide some economic stimulus to struggling businesses during this pandemic. Since its inception in June of last year, we have served over 174,000 meals to seniors locally, and we have provided over $4 million to the participating restaurants. We are accepting new applications, and interested seniors can call United's Way 211 or Monterey County's AAA at 831-755-4447 for more information. And I would like to thank United's Way staff for continuing to help us with screening applications and also the media for helping us to spread the word to seniors in the community about this program. And the second program that you mentioned is we're going to restart the AAA Cares Meals program, which is a parallel program to the Great Place to Deliver program for seniors that don't meet their strict criteria. So this enables us to serve an additional 150 seniors locally who are struggling also to really stay home and they don't have the resources to really have sufficient food and not suffer food insecurities. So we definitely need the word to spread out because we have capacity to serve more seniors. And I think this concludes my quick update, but I'd be happy to answer any questions. Thank you again for this opportunity.
Thank you, Diana, for jumping in and sharing that with us. Please stay on for questions later on. And now we've got another representative from our Department of Social Services office, and we're going to talk a little bit about social work. The month of March is identified as honoring social workers and the work that they do, but the pandemic has really challenged social work and assisting people. And Hugo Camacho, who is a social worker 3 and within the Family and Children Services Division of the Social Services, is going to join us and talk a little bit about that. Good afternoon, Hugo.
Good afternoon, everybody. My name is Hugo Camacho. I'm a family reunification social worker with Family and Children Services. Born and raised here in Monterey County, and I'm really it's a privilege to be able to serve my community. I've been with the department for about 2.5 years now, and every day is a learning experience, especially in the times of COVID. You know, this pandemic has really hit our community in a very really difficult and challenging way, especially for us to be able to provide services as requested by the court to our families that we serve. It's been quite challenging. When the pandemic first started, we really didn't know what was going to happen. You know, we were asked to go home all of a sudden, just one day to the other, and to continue our work from home. And that continued for several months. And within that time period, within about 3 or 4 months, we really had to become tech savvies, had to really become just knowledgeable with using Zoom so that we can connect with our caregivers, with our foster parents, and really be able to do our check-ins remotely, to be able to check in with service providers, and really to be able to check in with our parents. I mean, the first couple of months was extremely challenging, but luckily Family and Children Services has just a great team of social workers, clerical support staff, supervisors, management staff that really is just did a fantastic job in really supporting the social workers and to this transition into this pandemic. But one of the bigger ongoing challenges that was really revealed to us during this pandemic was the ability to provide services to our families, given that at least in my function, whenever we're working with parents, we refer them to therapeutic services, to parenting classes, to substance abuse treatment, to domestic violence classes, and really all of that went away when the pandemic hit. And although they came back in some form or another, mostly through Zoom, it still proved to be a challenge to some of our parents, especially those that really didn't have the resources to be able to connect on, to be able to use Zoom. So that was has been an ongoing thing. And I'm sorry, my daughter is in the background crying. But it continues to be a really ongoing challenge for all of us. We really got creative with being able to connect parents with resources. One particular godsend that we got was actually through Comcast, who opened up their free mobile hotspots all around Monterey County for individuals to use the internet. And really that came in extremely handy because it allowed parents to participate in meetings with the department, to have visits through Zoom with their children, and really just to engage in other services. And, you know, eventually, you know, as the department allowed us to transition back into the field, there still, you know, was a lot of just concerns, a lot of worries just with anybody. I know my wife in particular had a lot of concerns about me going back into the field. especially with, with the risk of being exposed to COVID. Luckily, the department was very supportive in ensuring that that the social workers, that all the supportive team had the necessary PPE to try to stay as safe as possible and following social distancing guidelines. But really, in this position, in this field, it needs to be recognized that whenever we're out in the field, that we are taking an assumed risk, that we are understanding that there is a possibility, a very high possibility, to be exposed to the COVID-19 virus. But like I said, it really does speak volumes to the commitment, to the willingness to provide services to our families here in Monterey County. It's been really tremendous to be surrounded by such great staff. We still continue our challenges on a daily level. Luckily, we've mastered, for the most part, the use of technology, and really when there was a prior to COVID-19, everything was done through paper and everything is done electronically. So there's really no need for us to be passing around papers for individuals to sign. We can just sign and email, and really that's been the workflow, and it's actually been really efficient. And I don't foresee that going away anytime soon, now that we've really found that and utilized that ability. And it's been intense. It's been challenging. We have to walk that fine line of staying safe, ensuring that we minimize our exposure, ensuring that our foster children are doing well, but also that line of we need to provide reasonable services to our families so that they can reunify with their children successfully and safely. So like I said, every day is a learning experience. Every day is something new. And I do want to be able to take this opportunity and use this platform to really thank all of our foster parents, because they've provided such an invaluable service to Monterey County. When we hear about in the news about parents staying at home because their kids are at home with school, the same thing has happened for our foster parents, where there's really not a lot of kids are in school right now. I know there's been a select few, but mostly all of our youth in Monterey County continue to be home. So our foster parents are parenting almost 24 hours a day. They're therapists. They provide transportation to appointments, whether it be visits, whether it be medical appointments, therapeutic appointments, etc. So I really just want to use this platform to really thank them for their selfless really contribution and really help to Monterey County. And really to remind everybody that Family and Children's Services, we're still here. We're still willing to provide, open to providing services to our community, open to continuing to work with our service providers to ensure that our families, and especially our most vulnerable population here, are safe and have the resources necessary to thrive. Thank you so much.
Thank you, Hugo, for speaking from the heart about what you do. You can tell how passionate you are about your work, and really glad to take this opportunity to highlight the work that you and so many others are doing during the pandemic. And if you would stay on the call, we'll have some questions for you after our next speaker. And we're going to wrap up our COVID information with Dr. Moreno, our health officer, who's going to have an update for us this afternoon. Hi, Dr. Moreno.
Hey, Mia. Good afternoon. Hello, everyone. Ed Moreno, Monterey County Health Officer and Director of Public Health. So today I just want to start off by sharing that we as a county continue to see evidence of success in our local efforts to reduce the spread of COVID-19. With regards to the state blueprint metrics, our countywide positivity rate continues to decrease. Our health equity positivity rate continues to decrease. And decrease in positivity rates in turn help to drive down the county case rate. Although our metrics are improving, as of Tuesday, March 9th, Monterey County's blueprints metrics remain in tier 1, the purple tier. As far as the blueprint, the state has been also reviewing statewide vaccination data and has developed a new vaccine equity metric. So this is based on apparent disparity among the 4 Healthy Places Index quartiles, specifically the quartile containing people living in places with the least healthy community conditions have received 18% of vaccinations. In comparison, the quartile containing people living in places with the most healthy community conditions have received 31% of vaccinations statewide. If vaccinations were more equitable, then we would expect that each quartile would receive about 25% of vaccinations. So the new vaccine equity metric tracks the number of vaccine doses administered to HPI quartile 1, which is the quartile containing people living in places with the least healthy community conditions. The state has determined that when 2 million doses are administered to HPI quartile 1 statewide, the state will change the case rate threshold in the blueprint for counties to qualify to move from tier 1 to tier 2 from currently 7 cases per 100,000 to 10 cases per 100,000. So the state has confirmed that when the vaccine equity goal has been met, Monterey County would need to meet red tier criteria for 2 consecutive weeks to move to red tier. So I think it's important for everyone in Monterey County to continue to make efforts to decrease the transmission of COVID-19, which can prevent the spread of COVID-19, prevent cases, prevent hospitalizations, and prevent deaths. So we need to continue to wear face coverings when we leave the house, to stay home as much as possible, to avoid gatherings, to continue to wash our hands frequently, and also to get vaccinated when we're eligible to get vaccinated. So there are now 55 locations in Monterey County offering COVID-19 vaccine to people that are eligible. Public Health and a few other vaccine providers are also offering COVID-19 vaccine point of distribution clinics in various parts of the county. And if people need assistance signing up for a clinic, they can contact 211 for help. And also finally, to get tested for COVID-19. People should get tested if they have symptoms of COVID-19. Anyone who has symptoms and get test positive should isolate to prevent further spread of COVID-19. Also, if an individual has had close contact with someone with COVID-19, that would allow a person to who may test positive to isolate themselves appropriately. Also, if someone can't work from home and has to work in a place where they engage the public frequently, those individuals can be at increased risk of exposure, and frequent periodic testing for COVID-19 might identify someone who has COVID-19, and when that happens, they can leave the workplace and isolate so that they can reduce transmission within the workplace. And finally, if your healthcare provider recommends that you get tested for COVID-19, that would be another excellent reason for a person to get tested for COVID. So that's my update, Maya. Thank you.
Thank you, Dr. Moreno. We'll let him mute that phone too that keeps going off in the background. So we've got a couple of questions and we'll go ahead and get started. And our first question is for Hugo, and I'm glad to see you're still on the line. We have heard nationally about a silent epidemic of child abuse during the pandemic as reporting went down. What did you see locally, and were fewer instances of child abuse reported? And do you expect to see an increase in calls when children are back in the classroom?
Well, I don't specifically work in the hotline unit or intake unit, but in my conversations with social workers especially from our emergency response team, and I remember having a very vivid conversation with one particular gentleman in particular, a social worker, where I asked them, hey, since we went into shelter in place, what is it looking like, with phone calls? And this is early on in the pandemic. I can't really recall the date or the month, but he did say that there was a steep decline in reports being made, where we usually got multiple, 20, maybe 20, 30 something calls in a day. We were looking at probably 1 or 2 calls that we were receiving in our intake hotline. However, in a follow-up conversation that I had with a different coworker of mine, a different social worker, it was reported that this is later out in the school year, that as children resumed school, as children participated through distance learning, that there was actually an increase in reports that were being made. So at the beginning, there was a steep decline, but it seems like we're receiving more reports now than before the pandemic. And in the second portion for that question, do we expect for more reports to be made once children are able to return to school? I believe so. I mean, at the end of the day, really, from my work with my kiddos in particular, they're really only in class for a very small amount of time throughout the day, usually like 2 or 3 hours at the most, virtually, in addition to their homework time. And so, I mean, there's only a certain amount of time in which mandated reporters are really laying eyes on the kiddos and really kind of getting to look at their background, as while they're participating in class. So, I do foresee there being another increase in reports being made, especially, I mean, we've been in shelter in place coming up in a year here in Monterey County next week. So yeah, I think that's a very likely outcome.
All right, thank you very much, Hugo. And our next question is for Dr. Moreno, and this goes to some of the tier changes that you were talking about earlier. According to the CDPH, 1.9 million and change people in HPI quartile 1 have been vaccinated. When the 2 million mark is met, when would the earliest Monterey County would be moved into the red tier? Is it possible, in your opinion, that the state's 2 million goal could be met in a couple or a few days?
Okay, man. So I don't know when the state will meet the 2 million goal, and I can't provide an estimate of how long it's going to take, but I can share that staff from California Department of Public Health did say that a county like Monterey County that meets red tier criteria prior to the state switching over to the new blueprint thresholds would receive credit for that week of red tier. So this past Tuesday was the first time that we dropped below 7. I'm sorry, soon back up. This week, our case rate was 7.2 per 100,000. And so if the state vaccine equity metric was met today, according to the state, it takes effect. The switch in the thresholds and the blueprint metrics would take effect the next day, and Monterey County would get credit for 1 week of meeting red tier criteria because of our current case rate of 7.2. But again, the state also said that Monterey County would have to have 2 consecutive weeks below 10 before moving into red tier.
All right. Thank you very much for that clarification. And then another question for you. With the new vaccination criteria, well, I think you may have answered this question. Would Monterey County be moved immediately into the red tier when that 2 million threshold is met? And you're saying that we would get credit for our week, but we wouldn't move immediately, correct?
Yes, just a lot of, we get that question a lot. So I had an opportunity to ask staff at CDPH, and as of today, the state is saying that Monterey County would have to have 2 weeks, meet 2 weeks of red tier criteria to be able to move into red tier. So unless that changes, and that could change because of course the governor announces that the goal has been met and the case rate threshold in the blueprint would change from 7 to 10. The governor could announce some additional changes to how he wants it implemented. But as of today, we have met 1 week of what will be the new threshold because our case rate is 7.2 and our 2 positivity rates have dipped to the red and orange tier. And then next Tuesday, if our case rate was still less than 10 and our positivity rates were at least in the red tier, from what I understand, the following Wednesday, the state would designate us as a red tier county.
Thank you. And then another question for you. Is the new vaccine metric seen as the easiest way for Monterey County to move into the red tier? Or do you think Monterey County could see other metrics such as case rate, positivity rate, et cetera, reach the needed criteria next week?
Thank you, Maya. So at some point, as long as the vaccine is made available to all counties, at some point we expect that the state will meet its vaccine equity metric goal of 2 million doses to HPI quartile 1. So that is something that really depends on all counties continuing to do what they can to reduce cases, reduce transmission, reduce cases statewide. I think what's really in our control is, and the state is making these metrics and metric determinations, so that the state has control over that. What's in our control is, as a community, is to continue to make efforts to reduce transmission of COVID-19. So I think that's really what we really need to focus on, because the state metrics really depend on how the level of transmission in each county. And so we have some control over wearing face coverings, staying at home, washing our hands, keeping our distance from other people. That's what we have control over. So we should continue to implement those practices. And if we're successful in doing that, then the case rates should continue to decrease and the positivity rate should continue to decrease. So I think we just have to keep doing that, doing what we're doing. And then at some point, it looks like there's a good chance that Monterey County will eventually meet the red tier criteria.
And then just a follow-up on the timing of all this. Does this mean the tier adjustment would happen on a Tuesday when the state updates its metrics?
From what we've heard on calls with the state, the state is looking at the number of doses administered to quartile 1 communities statewide on a daily basis. And so from what we understand, unless the state changes this, from what we understand, on the day that the state confirms that 2 million doses have been administered to quartile 1 communities statewide, the change in the blueprint thresholds for moving from purple tier to red tier would take effect the next day. And it wouldn't necessarily fall on a Tuesday.
Okay. All right. Thank you for that. And then another question for you. When do you expect Monterey County to switch to the myturnca.gov system? And how would this affect vaccine equity in Monterey County?
So we are still participating in trainings on MyTurn. And so we have several people who are signed up to participate in those trainings. So we still have to complete some training before we can switch over to MyTurn as a vaccine provider. Other vaccine providers in Monterey County are on their own schedule to switch over to MyTurn, meaning that they have to sign up for trainings as well in order to understand how to use MyTurn. And not all vaccine providers in Monterey County will be onboarded to MyTurn on the same day. So I asked that question to folks, and that was what the response I got. Vaccine providers can switch over to MyTurn when they're ready to switch over to MyTurn. So I don't have an exact date on when we anticipate being switched over to MyTurn.
All right, thank you. And then what appears to be our last question, which may be for you and it could also be for a larger group, is Monterey County considering opting out of the Blue Shield vaccination program like some other counties have suggested?
So let's see. I would say, let me just see if Elsa Jimenez is here. I don't see our health director here. I'd say at this point is that we continue to have conversations with our attorneys, our county attorneys, regarding the language in the contract. And so at this point, it hasn't been determined whether the Monterey County will sign or not.
All right. Thank you, Dr. Moreno. And that is all the questions that I have in chat right now. Are there any other questions for any of our presenters before we end this media briefing? I'm not seeing any. Then that will wrap it up for today's briefing. We'll see you next Wednesday. Have a great day.